Hi, welcome to today's edition of Health Feed. I am Katie Wick, your host, and we're here today to talk about a variety of topics and our City of Sioux Falls Health Department clinic, Falls Community Health. With us today is Dr. Jennifer Tingley. She's our Chief Medical Officer at Falls Community Health. Welcome, Dr. Tingley. We're happy to have you today.
Thank you. Thank you.
Let's just start off with a basic. What is Falls Community Health and who do we serve?
Yeah, thank you. So Falls Community Health is a primary health care clinic, so kind of considered a family practice clinic located right in downtown Sioux Falls. We're located right next to the Multicultural Center, just central to where lots of people live and work. We provide primary care services, so we will see kids, we will see adults, we will see older adults. We provide all of our cancer screenings, just anything that a primary care clinic would do. We serve a variety of patients. We would be considered kind of a healthcare safety net for the community. So if a patient doesn't have insurance, we do offer services on a sliding fee basis. But we also would be happy to see any patient that has, a public insurance program like Medicaid or Medicare. We also take private insurance plans as well.
Okay, so we have our clinic down at the corner of 4th and Main, downtown. Yep. Do you have other locations?
Yes, thank you. Yeah, we do have three. We have three tinier clinics located within elementary schools here in Sioux Falls. So they are located at Terry Redlin, more on the east side of the city, Hawthorne Elementary, located right in Central, very close to our main clinic, and then we have Hayward Elementary on the far west side of town.
Okay, and in those school-based clinics, tell us, is it just school children we serve, or do we serve the public as well?
No, those are considered public-facing clinics while they're located in the school. So we would love to see children that need to be seen on the day they have a stomach ache or a toothache, but we are open to anybody in the community. And you don't have to actually live on the west side of Sioux Falls to be seen at the Hayward Clinic. If that works for you and you want to make that drive, we would be happy to see anybody.
Great. And talk to us a little bit about how patients get appointments, or how that works. Is it walk-in? Do we like to schedule appointments? How do we manage that?
Boy, we can do it a variety of ways. Obviously, calling our clinic, 367-8793. You can call and make an appointment at any one of those 4 clinics. But if somebody were just to want to walk into one of those clinics, that's also very much welcome. We do have the capacity to see patients on a walk-in only basis. Mm-hmm.
Okay, and how about our hours?
Yep. So Monday through Friday, we're not open on the weekends, but on Mondays we are, our main site anyway, we are open from 8 in the morning till 6 in the evening on Mondays and Tuesdays. On Wednesdays and Thursdays, it's 8 to 5, and then on Fridays a little bit shorter, from 8 in the morning till 3 p.m.
Okay.
Yep.
And so tell us a little bit about the makeup of who sees patients there. Do we have physicians, nurse practitioners? Talk to me a little bit about the makeup of our staff.
Yeah, we do have a variety of staff that work at that clinic. We have a makeup of medical doctors. We also have nurse practitioners and PAs. In addition, we are the training facility for the Sioux Falls Family Medicine Residency. And so our soon-to-be medical doctors, they are medical doctors, but they are in training. They work at Falls Community Health as well. And so, a patient could come in and see any one of those providers. We have a lot of other staff, though, that work at our clinic. We have social workers, we have nurse case managers, we have a dietitian, we have mental health counseling, chemical dependency counseling. We have a dental clinic actually upstairs from our main medical clinic. And so there's just a variety of services that we can provide.
Great. So we're talking about services, and we'll probably talk a little bit about COVID. Yeah. We've gone through that the last couple of years, and we'll kind of do an update on that. But coming up on the summer months here, what are some of the things that we like people to think about during the summer to keep healthy over the summer? Kids are getting out of school very soon.
Yep.
So what are some of those things that we can look forward to do and catch up with over the summer that maybe we haven't done in the last couple of years?
Right. Well, and I think that's what it's really important to kind of recognize the fact that we have been living in this world for the last couple of years that has been so focused on COVID and keeping ourselves healthy and away from that particular illness. But it may mean that people have kind of left some of their general healthcare maintenance behind. Some people were avoiding going to the doctor, maybe a little scared that they might come in contact with somebody that's sick with COVID. So we're really encouraging people to kind of get back to just their main healthcare priorities. And if you have a chronic condition, hopefully they've been, people have been coming in for that. If it's diabetes or hypertension, we hope that people have already made it back to the clinic to kind of make sure those conditions are under good control. But if you don't have a chronic condition, we all need to have our preventative health care screening. So things like cervical cancer screening, breast cancer screening, immunizations. I think that's one thing that people have really let kind of, we'll do that later. But we need to make sure that people are caught up on their vaccinations. Obviously very important for kids, but even as adults, I think we sometimes forget that our tetanus shots need to be updated. There's some new guidance on pneumonia shots and some new vaccines that have come out with that. And so just making sure that people are getting those vaccines as they need them. Then of course, COVID vaccine, we can't do a show without talking about that. COVID vaccines are available at our clinic as they are available at all clinics in Sioux Falls. Pharmacies still have COVID vaccines. So if people haven't gotten their booster shots, for example, or maybe haven't even started that COVID series, that's still a vaccine that we really think is important to get.
Right. So going into the summer months, what are some of the other things that we can think about, like making sure we're having sunscreen, bug spray? Talk a little bit about some of those summer activity kind of things that we can do to help keep ourselves healthy.
Right. And I think just thinking, we're hoping that warmer weather comes soon. It seems like it's been a rough spring so far, but we're really encouraging people to get outside, get back on the bike, get on the bike trails, go for a walk, a jog, a run, something like that. But if you're going to be outside, making sure that you're protecting yourself against those elements. So wearing sunscreen, long covered, long shirts or a hat, especially if you have fair skin. But sunscreen is obviously the easiest way just to protect yourself from any sun damage that may happen, prevent any skin cancers, melanomas, things like that. The bugs will be coming back. We know that mosquitoes abound. Our city does a really nice job of helping us stay away from mosquitoes with that spraying, but they're still there, and so we want to make sure that people aren't exposed to a potential West Nile infection. And so using bug spray if you're going to be out, especially early morning, kind of late afternoon, early evening when the bugs are very plentiful. We want to make sure that people are doing that. If you're out riding your bike, making sure you're wearing a helmet. That's a great way to prevent any head injuries that can be very catastrophic for somebody's life. But I just want to encourage people to get outside, get moving. We could all use the physical activity, but I think recognizing there's just been a lot of stress the last couple of years, and I think motion, movement can really help alleviate anybody, if they are struggling with some anxiety or mild depression, things like that. Sun is very helpful for that, as is motion, movement.
Absolutely. Yeah. Okay, so we've kind of gotten through that. So let's get back to the COVID discussion again, which everybody's a little bit tired of it, but we're not quite over with all of this. So talk to me a little bit about where you feel like we stand right now.
Yeah, I think we all wish that we could just be done with it, but I do think that COVID is probably going to be one of these illnesses that is just with us probably indefinitely, kind of like influenza. It never really kind of goes away for a little bit, but then there's going to be another wave. And with influenza, we know that that's more in the fall and winter, but with COVID, we've seen that we get some big spikes in the summer. It doesn't have to just be cold winter months that we're seeing it. And so right now in Sioux Falls and South Dakota, we're enjoying some lower disease activity with COVID, but it's not completely gone. And we're watching very closely what's happening, especially in some of the larger cities. They're starting to see uptick again in cases. And so we know that South Dakota, the Midwest, we tend to lag behind just a little bit. When the bigger cities are starting to see that influx, we may be a month or so behind. And so we're keeping an eye on that. One of the things just to keep in mind, though, when you're looking at case counts, if you read something in the media, a lot of people are doing home tests. And so we may be actually undercounting just how much disease activity is out there. The good news is we're seeing low hospitalization rates right now, low death rates from COVID, but we really can't let our guard down, because it is one of those illnesses that it keeps changing. There's these new variants that keep showing up. And so we want to make sure that people are getting their vaccines, if they haven't been boosted, to get their booster shot. And if you have any underlying chronic medical conditions, making sure that you talk to your medical provider to see if a second booster might be appropriate for you.
So some of those mitigation efforts still stand, especially if you have some of those chronic disease or underlying, you're more susceptible to getting more ill. So if you had to name your top 3 things that people can do to help keep themselves safe, what would they be?
Right. First, vaccines. I think that is the best way to protect yourself from this illness. as with other infectious diseases as well, getting vaccinated is incredibly important. If you do have underlying health conditions and you are going to be in a place where there's a lot of people, wearing masks is still a very good idea, very appropriate thing to do. And then I think just as we look out for one another, if you are ill, please stay home. Don't go out to the concert. Don't go to church. If you can stay home and do that in a safe way to not expose anybody else. And the other thing too, when you are feeling ill, making sure that you're testing for COVID, because we want to make sure that if you have that illness that you're not out in public for a certain amount of time, and that would be very nice to have a home test. And I just want to hit on the fact that down at the Sioux Falls Health Department, we do have home tests that people can just walk in. They can come in and get a couple of those home tests to keep on hand. I know in my medicine cabinet, I've got about 3 kits that it's just if somebody wakes up with a sore throat, runny nose, let's just make sure it's not COVID before I send you to school or before I come into work.
Yeah, so I think that a couple of things to talk about the masking. We also have those available at the health department. For anybody who's vulnerable and needs a mask, we have some N95s available. Yep. And the test kits. So I think that we need to normalize the test kits, just like you said, having it in your medicine cabinet.
Right next to the ibuprofen or Tylenol. It's just something that you have on hand, because I do think COVID is different. You know, it's not just the common cold, and some people get incredibly ill. A lot of people have died from COVID, and we're finding out about long-term consequences of having a COVID infection. So if there's a way that we can stop that spread, we want to make sure that we're not exposing a lot of people to this. So testing, it's so easy. It takes 5 minutes to do it. It's not that uncomfortable. Just have a test kit ready, check, and then if you don't have COVID, as long as you don't have a fever, you can carry on with your day if you feel well enough to leave. So yeah.
So, well, Dr. Tingley, we appreciate your insight, your input, letting us know about Falls Community Health and all of the great services that we have to offer the citizens in Sioux Falls and their surrounding area. So,
well, thanks for having me.
Yes.
Yeah, I appreciate it.
Thank you for joining us today. If you'd like more information, please visit our website at siouxfalls.org/health, or you can call our health clinic at 605-367-8793.